So being a sort of creative agency guy and looking at this format and thinking, I've got to present and not really know what's going to come out next, that part was okay to me. But when I came up with a topic for today, I thought, why not focus on talking about the past, present, and future of healthcare with a tool that probably half of you in the room consider insignificant. So what I thought I'd do is focus on Twitter, and in particular, how 20 tweets can tell the past, present, and future of healthcare and the world that we live in now, what we've been talking about, what I've seen yesterday, and I'm going to try and do it without any notes or anything like that, so luckily I have the screen here, otherwise I was going to go back and forth and look. So let's start with the doctor, right? The doctor's at the center of healthcare, and for the most part in the past, the doctor was the hero. There were a few crazy scientists, right, like Doc Brown, the Back to the Future doctor, right, came up with crazy stuff, but for the largest part, doctors were at the center. They were the ones who had the answers, and everybody would go to them for the answers, right? Media went to them, patients went to them. And patients were largely in a passive role. The doctors prescribed whatever they were going to prescribe. The patients took that, and they would either adhere to it or they wouldn't. But from a patient point of view, the control was really out of your hands in the past. The doctor would tell you what to do, the medical community would say what was involved in that, and it would be your responsibility to follow that. The support that you were offered as a patient was largely based on people that you knew. It was your personal relationships and the people that were in your immediate circle. And if you had a rare condition, then you were sort of out of luck because you didn't really know anybody in your community, and those people were very difficult to find in the past. The other thing that was interesting was that when media covered any of these things, it was a very controlled top-down sort of atmosphere as well. And if you go to the same sort of events or you read the same media that I've read, really part of this idea is that media was a controlling funnel. And now control shifted. The control is now in the hands of each of us, whether you look at healthcare or whether you look at any other industry. And the reason for that, or part of the reason for that, is because content creation is totally easy now. You don't need to know all of this stuff in order to create content. All you need to do is grab a flip camera, plug it in, and off you go. Or press a button and you can publish a blog post. So anybody can create content. That's the world that we live in today, and anyone can find it. So from a medical point of view, what this means is that people in the medical industry, doctors, nurses, anyone in the medical complex has the ability to influence more than just their patients. Very powerful idea in the present. Because now doctors can publish information, they can say you should do this, here's the information, they can refer each other back and forth. It's not just based on who your patient is. From a patient point of view, patients are looking for recommendations on everything from doctors to treatment. They want the advice, right? This is the e-patient revolution in part. It's people seeking advice and people answering those questions. Question posted online, answer posted online. That's happening in a variety of different sites, a variety of different ways. The other interesting thing about a tool like Twitter, but also the rest of social media, is that people can comment on the treatment that they're getting in real time as it's happening. So you don't have to wait for someone to have an outcome necessarily. They can react to what they're seeing and what they're feeling right away. It's a very real-time voyeuristic kind of thing. And if you're watching that board over there, you know that this speaking is sort of the same thing. Now, the control for patients is not just around their treatment, but also around being vocal advocates for their causes. So they can be the voices that now create advocacy movements, that create groups, that do things like diabetes awareness around specific months. The control is there for the patients. And if you look at something like this, all of these thumbnails all have a little blue circle on them, which is the symbol of Diabetes Awareness Month and people who are supporting that condition. They all can put that on their Twitter profile, and now it can be part of their virtual identities. So we all have identities online. What all these people are saying is that I want to be associated with this cause. This is important to me. So the bottom line for the present is that what Health 2.0 means is that patients today have their own voice, and they share their own experiences, and they can help each other. So if that's where we are today, then what does that mean for the future? And that's where I'll focus the rest of my presentation on, which is the second half, if you're keeping count. Which, of course, we all are, right? The first piece of this is that the amplified word of mouth of what people think about the healthcare that they're getting is going to make or break providers in the future. Today, it's sort of incidental. It matters. People find it, but a lot of people don't find it. And in the future, as we're able to each grade the health care that we're getting, that's going to become much more influential. The other huge topic of conversation that I know has been kind of talked about in the media and at this event is electronic medical records and how that's going to impact the power that patients have over managing their own conditions, because now the records go with them, and you have less of an ability to kind of lose them or any of the other issues that medical records have had. But if you think about the real power of this, if medical records are all implemented and able to be aggregated in some way, hopefully anonymously at some degree, then the research that would be available from that is so much more powerful than a clinical trial, in some cases, that's limited, right? Because you can do it across so many patients. So what that means is that there isn't this doctor-patient one against the other sort of thing anymore. In the future, they can work together, and doctors can freely admit that patients have more knowledge about certain conditions, and patients can be comfortable with bringing that knowledge and not feeling like they're going to get shut down because of it. The other thing that impacts doctors is the idea that social networks, such as Sermo or Osmosis or any of the other ones that are coming up, allow doctors to get outside help for things that they don't know. Nobody likes to admit that they don't know something. But when it comes to social media and these tools, it enables healthcare professionals to not only admit that, but get the help that they need. And as we think about a bigger issue, and as I kind of close out here, one of the bigger things that this is going to enable is for us to ask big questions and get answers from unexpected places. And that's a really powerful idea, because right now, questions are asked within communities and they stay within communities. And in the future, they can move out of those communities. And the last thing that I'll leave you with is marketing's role in this is to create great content and participate in these communities. And if you haven't seen this presentation from Dan Rome, it's called Healthcare Napkins. Google it, look for it on SlideShare. It's an amazing description of healthcare reform in America today, done on a series of napkins, and a very powerful idea. So thank you very much for listening. This is my 20th slide, and I've come in just under time. And these are the ways to contact me on this slide. So thank you.